Answer some questions and talk about an article that I brought up yesterday during our shoulder health webinar. So I actually talked to the orthopedic surgeon last night that first told me about the article. It's currently in revision, so it's not published yet, but I can share some of the information about it here now. So over a year span in the US, they looked at ICD-10 diagnosis codes as well as the ICD-10 treatment codes. They looked at, I think, full thickness rotator cuff tears as well as shoulder cortisone shot injection treatments. I'm not 100% positive on the methods, but I know that the group then looked at, okay, let's compare individuals that had rotator cuff tears and that had rotator cuff repair surgeries, and they compared groups of who had cortisone shots and who didn't. So the results were pretty staggering. They looked at different interval times. And even at a year out, if you had a cortisone shot injection in your shoulder and then you had a rotator cuff repair, you were twice as likely as someone who didn't get a cortisone shot to re-tear your repair. So I think the big question people may ask is, why is this article important? Why does this data even matter? And it all goes back to how important that first doctor visit is. And what do you do when you experience shoulder pain for the first time? Number one, please go see a physical therapist before you let someone stick a needle in your arm. The three of us are physical therapists. We're always going to advocate for the field, and you need to exhaust conservative care before you even consider someone sticking a needle in your arm or getting surgery. There are so many modifiable factors that play a role in the outcomes and prognosis of rotator cuff repair surgery. This includes smoking, body composition, cholesterol, and tissue quality. By tissue quality, I mean how much muscle do you have versus how much fatty infiltration do you have in your rotator cuff muscles. That plays a huge role in the prognosis for how well your rotator cuff repair surgery is actually going to go. A really simple analogy that I use to educate patients in the clinic is compare a sirloin to a ribeye. We're talking very lean meat versus marbled meat. As physical therapists, we can play a role in changing this tissue quality. And you should always exhaust conservative care first. Even if it doesn't go well and you have to get surgery, you're going to have better outcomes after surgery because you put the time and effort into getting stronger, your shoulder being able to move more, experiencing less pain, and you may even second guess if you should get surgery at all or not. There's a lot of people that the three of us have seen that are dead set on surgery. They do PT and then they change their mind. So please go see a PT first, or please see someone that's telling you to exercise and move more before the first thing that they want to do is stick a needle in your arm. And tune in to more of our webinars. We're going to be sharing more information just like this. Hope you enjoyed.